About 24 years with Calvo Select Care. Then public high school teacher Jennifer Berry transitioned to Net Care, and just last year she chose Take Care. Berry had the option to utilize 3 different health insurance providers under the previous administration.
I just felt like I was shocked when I learned about it actually because I had the luxury of having a choice of picking my insurance company.
Now no longer having that luxury, Berry tells KUAM she is concerned for her health.
I was really disappointed that I didn't have a choice. And then when I went to open enrollment and looked at what they offered, I was even more disappointed because I'm 53. I'm older. I have some. I have high blood. I have high cholesterol, diabetes, and I'm interested in the nutrition program, the diabetes program, the things that help me to keep my cholesterol under control.
These were all programs she opted for, and now with the government's decision to switch to a sole provider, Aetna International, these preventative programs are all virtual reality. Berry says this is counter to Guam's culture.
On Guam, we like to have face-to-face contact.
2 weeks into the government's health insurance open enrollment, the director of administration, Edward Byrne, says he believes the transition is going smoothly.
I'm hearing a few things, but it's a very small percentage. And most people, and the people I asked after they'd registered, are very pleased with the coverage and are getting the care they need.
However, more than 1,000 GovGuam employees have signed this petition, stating why they want to keep their current provider. KUAM brought the question forth to our social media outlets, asking the community their thoughts. One comment says, quote, "Some will say in the private sector the employer chooses your health insurance, but GovGuam isn't the private sector. Here in the federal government, we are given a choice with what health insurance best suits our individual and family needs. Why the sudden change in healthcare choice? Why wasn't there more discussion and transparency with this? That's the real question," end quote. Marissa Phillip Manabusan commented on KUAM's Facebook page and said she does not care about the worldwide services this insurance offers and has been fine with Calvo Select Care insurance. Manabusan points out concerns with deductibles. Anyways, the Calvo Select Care deductibles were $1,500 for single and $3,000 per family. With this Aetna insurance, the deductible went up $1,000 more. What the bleep is wrong with you people? We couldn't even reach the $3,000 deductible and the fiscal year was up, and what more with the $4,000? You politicians need to stop gambling with our lives. You all need to stop with your political bleep. Support local? Is this how you support local businesses? End quote. Byrne also acknowledges that there have been more than a few complaints about a substantial increase in premiums.
Take care patients, and indeed, again, I was one of those, did experience an increase, but that was principally because Take Care didn't cover certain providers that are now being covered. So, and also, please recognize that the last increase was 2 years ago, and medical costs have increased in the intervening period.
Berry's previous insurance company, Take Care, has filed a court complaint challenging the award of the health insurance contract. But Byrne says DOA consulted with the Attorney General, who advised that they could proceed. But Berry, like many government employees, are not as eager to carry on with Aetna.
I'm not planning to do any of the virtual kind of counseling that they have because it won't work for me. I'm not interested in that, and I can't be the only one that's not interested in that. We really need face-to-face contact for supports like that.
Reporting for Guam's News Network, I'm Adriana Cotero.